We work hard for our license. Let's keep it. This is She Nurse Savvy. Take a listen to these 6 tips that you do not, I repeat, do not want to do in order to keep your license, but these ones will get it revoked. So let's get into it. Substance abuse or drug diversion. Using or stealing drugs meant for patients or working while being impaired. You know what that is. High, drunk, impaired. It's a major violation. They not playing with that. And sometimes people don't get caught the first time. But when you caught, baby, they gonna investigate you. And it's gonna be real bad. Number 2, patient neglect or abuse. We are here to help. We are not here to abuse. Please, if you have issues where you're trying to abuse your patients, it's time for you to go. Any physical, some emotional, verbal, sexual abuse, nah, we not having it. Or failure to provide appropriate care can lead to revocation. Now, emotional abuse can be subjective because some people are emotional human beings and it can be portrayed a different way. We all are emotional, but some more, some less. The thing with that, it's a little tricky, but physical, 100%. Yes. Physical abuse, yes. Sexual abuse, yes. Verbal abuse, that's if you caught. If somebody catches you. If it's hearsay, it's going to get swept under the rug. But if somebody catches you, yes. Number 3, this is something that I talked about in my other video about nurses getting fired and how not to. Falsifying documentation. Falsifying of their records, documentation, that's the same thing. Altering or fabricating patients' charts, medication administration records, or credentials is considered fraud across the board. They not playing with that. You losing your job, you losing your license if somebody knows about it. Number 4, unprofessional conduct or criminal behavior. Felonies, DUIs, acts of violence against patients, even boundary violations can trigger disciplinary action. Now, when going into a job as a nurse, the hospitals run a background check. They check your license. If you have felonies, they're not going to take you. It's a reason why you see a lot of grumpy nurses that won't leave their job, that's stuck. Remember, when you get another job, they run a background check. So that could be the case. They got something on their record and they stuck there. Because if they go somewhere else, they won't have a job. And if you come back, sometimes that triggers for that job to run a report on you as well. Number 5, incompetence or gross negligence. Repeated clinical errors, failure to follow protocols, putting patients in serious danger because you have poor judgment. When reported with the right documentation, license revoked. They are not playing. You are not getting no cushiony job, making a lot of money as a nurse if you are doing gross negligence. If people know about it and they reported it to the State Board of Nursing, you're not going to have your license. Sorry. And number 6, practicing without a license. Now, people are saying, well, you need a license to get the job. Yes, you do. And we all seen in Florida where those nurses was paying to get their credentialing so that they could take the boards and pass boards, and they just working out here with no schooling, no clinical rotation, none of that. Just paid the money, took the test, passed it however many times they had to take it, passed it, and they out here working, making medication errors, grossly negligent. People are unalive because of the lack of knowledge that some of those nurses had. It's all a no-no. And that's one way that I'm talking about working without a license. But another thing is when you work as a nurse and you don't update your CEUs, nurses, we know what CEUs are, the continuing education courses that we have to take, and you let your stuff expire. So now you're not an active nurse, but a lot of facilities have someone to go in and double check to see what your expiration date is on your license. If not, you just can be working and not be licensed. So if something happens happens and they have to do something to you and your license expired, you're not getting a license back. Not that easy. And you losing your job. And whatever facility you work at possibly can get sued because you weren't licensed. So the first thing that hospitals do is they fire the person that's not licensed because it makes them look good, as well as they're trying to prevent someone from suing them based on them not following the protocol of keeping their nurses, making sure that their nurses' licenses are up to date. There are some nurses that get jobs still if their license was suspended and maybe it's going through like a little temporary or limited phase. They will work, not at hospitals though, because we give narcotics. So what a lot of those nurses may do is they will go and work at some type of outpatient, something that doesn't give any narcotic, because you can't have a limited license passing medications that are, addictants or stuff that you can't get over the counter. So each board of nursing has their own guidelines, but those 6 actions that we discussed are consistently seen as grounds for revocation in the United States. Overseas, I can't tell you because I am a U.S. nurse. I don't know anything about overseas, but hopefully this is not the case for you. Send this video to a nurse that has been in practice just to let them know, hey, I'm looking out for you. I want you to keep your license. And sometimes, as we've been a nurse for a little bit, 2 years, 3 years, 10 years, 20 years, 30 years, still working though, you kind of get a little cocky, like, ain't nothing going, ain't nobody taking my license, blah, blah, blah. But you got to make sure that you are focused on doing the correct thing and don't do shortcuts, because sometimes those shortcuts turn into things that can be reported, as well as you will not have a job and you will not work anymore as a nurse, and you have to find a whole nother job, a whole nother career, because your bills are still coming. If this was helpful, I have another video that you could take a look at on how not to be fired as a nurse. It's some stuff that people don't think about that are fireable offenses. Take a look at that.